Good morning, David Johnson here from the Back Pain and Functional Movement Training Centre and of course City to Coast Neurosurgery. Today we're going to talk about functional on one side versus structural rehabilitation. Okay, so functional versus structural rehabilitation, and I'm going to use rehabilitation interchangeably with treatment. Okay, so structural versus functional rehabilitation or treatment, and let's start on the structural side of things in relation to back pain or spine-related pain. The ultimate structural fix that we can offer someone is surgery. Okay, and that's what I do Mondays and Fridays, operate on people's spine. I am altering the structure of their spine to address a problem. Let's think about some other structural things that happen. We can strengthen muscles, okay, strengthen. And often you'll hear people talk about core strengthening or strengthening your back. Other things that people say, it's work hardening. Often in the workers' comp fields, we talk about work hardening. Okay. So strengthening, stretching the soft tissues, stretching. What about manual therapy? So there's a lot of manual therapy that happens to people with spine-related pain and back pain. And again, it's addressing the soft tissues of the spine and back and neck and shoulders, where we're trying to change some element about the patient's structure. There are numerous other structure-related rehabilitation or treatments, and we could say even cortisone injections. Cortisone injections. We're trying to alter the structure about where that injection was directed. So say we inject it into the facet joint or into the epidural space, we're trying to change the way that structure is behaving, and predominantly it's to reduce inflammation in a joint or around a nerve, or in the soft tissues related to the spine. So the cortisone injections can be directed to multiple different structural locations. In saying that, cortisone is a medication, just like anti-inflammatories. So we could say ibuprofen, Voltaren, Celebrex, Mobic, Panadol, codeine, endone, Tarjan. Those are all medications that are trying to modify the way that a structure is behaving. Okay, so we're trying to modify nociceptors in the spine, morphine. Okay, so there's a whole host of them, and I just listed off a whole host there. These are all structure-focused remedies. We could go on, the list could go down even further. Actually, I can add Pilates to this. We can add Pilates to that. We can go down prolotherapy. The musculoskeletal physicians love delivering this. Platelet therapy, platelets, delivering platelets around a joint to change its structure. And so these are very common things, and I'm sure if you've had back pain for a long time, you probably have tried most of these treatments, okay? Maybe short of surgery, because surgery tends to be left at the end of the line. It's the last station along the line because it's associated with the perceived highest risk and greatest expense and change to your quality of life. These are usually the first, second and third line things that people try when they begin to feel pain symptoms in a relapsing remitting format or in a chronic way. So now let's have a look on this side of the board and have a think about the functional rehabilitation. So we could say, remember, functional doesn't have any influence on structure because it's a completely separate type of rehabilitation. Totally separate. We could say education. Because we're now learning about the condition that we have. We're learning about the pathophysiology, we're learning about biomechanics, we're learning about drugs that help us, what are the side effects, what are the benefits. So we're learning about the risks of surgery, we're potentially learning about the areas of the spine that may be compromised, whether that's accurate or not. It's most definitely a non-structural treatment approach. Okay, education, and then the other thing is skillful movement. Skillful movement. Okay, not skillful movement. The key word here is about skill. This is a very much a qualitative factor, not a quantitative factor. So it's how good do I move my spine? Not, which is not equal to how strong am I? Okay, or how stretchy am I? How much mobility, or what's my range of motion? You know, often people who manage back pain and musculoskeletal conditions will want to know what the range of motion is. Can I turn my head a certain number of degrees this way or that way? And we use that as our metric to determine improvement or not. But they're all structural remedies, structural focused metrics. But when we're talking about skillful movement, we're talking about the quality of movement. And so therefore, functional movement, and we can call this skillful movement or functional movement. Falls into the category on this side of the whiteboard. It's a functional remedy. And there really aren't too many other types of functional treatments or functional rehabilitation. It really comes down to education and the skill of movement. Because if we think about our musculoskeletal system, the primary purpose of having a musculoskeletal system, muscles, joints, ligaments, tendons, is for movement. And so if the musculoskeletal system, which includes your spine, is failing, then the disability must, by then definition, be a functional problem. Now, if we break these down further and analyse what they are actually addressing, we can sort of filter out, is the treatment addressing a symptom, or is the treatment addressing a cause? Because if we're not addressing a cause, then that treatment will most likely ultimately fail. So let's have a look at surgery. Surgery most definitely addresses a symptom. Okay, so he addresses a symptom, so it's not going to address cause. Okay, because the tissues break down because of a reason. The disc breaks down because of a reason. Instability occurs because of a reason. So they're all downstream effects of something else that causes them. So surgery is addressing a symptom, not a cause. Our muscles may weaken, and something else has made them weak. So pain may have stopped you from exercising, and hence your muscles have become weak. If I address that strength with strength training or core strengthening, I'm addressing a symptom. Okay, so weak muscles is a symptom. Have my tissues become tight? Something has made them tight. So if I try to do lots of stretching, I am addressing a symptom. Okay. Manual therapy. If I receive manual therapy, I'm addressing irritability and inflammation in muscles and soft tissues, but I'm not addressing why those tissues became inflamed and tender in the first place. So manual therapy is purely addressing a symptom. If I deliver some form of medication such as cortisone into the joint through an injection, or if I take an anti-inflammatory, paracetamol or an opioid, I'm addressing a nociceptor, a pain receptor that's become active, but it's not addressing why the nociceptor became active. It's not addressing why my body needs the injection therapy or the painkiller, because it's purely a symptom that's being addressed, not a cause. Okay. And likewise, prolotherapy, platelet therapy. Why does my body need to repair my cartilage or ligaments or periarticular soft tissues with platelet-rich plasma? Those joints have become compromised because of a reason. So therefore, if I give it platelets, it doesn't actually address the reason. It's just fixing the problem. So this is symptom-based treatment. And if this is the only thing that you've done to manage your condition, then you've only delivered symptom-based remedies. You haven't delivered any cause-based remedies. Now, if we go to this side of the whiteboard and we think about education and skillful movement, we could then conceptualize that lack of knowledge and that lack of skill in moving your musculoskeletal system, is that addressing a symptom or a cause? Well, these would logically appear to be primary causation. Okay, so these types of treatment, skillful functional movement and education, are not symptom-based remedies. These are addressing cause. Okay, and now we have a model for the effective management of musculoskeletal pain, and in particular, of course, our expertise in spine-related pain, back pain. But we now have a model of addressing cause, and it is scientifically robust and watertight that if we leave out a management therapy that focuses on addressing causation and only deliver symptom-based therapies, then ultimately the overall management strategy for your musculoskeletal and back pain in particular will fail. Okay, so I hope that makes some sense to you. If you're going to be successful in managing your back pain, you have to have management strategies that focus on causation in conjunction with the appropriate management strategies that focus on symptoms. And that's why it's extremely important to understand the difference between functional rehabilitation and structural rehabilitation. And as far as I'm aware, the only location that cause-based functional movement therapy is delivered is through the Functional Movement Training Centre and the Rehab program. Okay, and that's why it's such an important service for my patients and for my neurosurgical and spine surgical practice. So, thanks very much for listening, and I'll see you next time.